My name is Douglas Mathews, and I'm a board-certified neurosurgeon. I trained at Vanderbilt. I've been practicing neurosurgery in Middle Tennessee for 17 years, and I treat adult neurosurgical conditions in both a non-operative and operative way. The key areas of interest for me have been predominantly spinal conditions, and have enjoyed taking courses that allow me to not only identify patients' pathology, but help to treat them in a less aggressive way. I find each one of my partners to be relatively conservative in terms of the surgical care they provide, and wanting each and every patient to feel like they matter. I find great success in having good relationship with my patients when I involve them in the care. And by involvement, I mean, one, educating them about their problem. They need to know what their condition is and whether or not it's something that may be able to be treated non-operatively. And when it comes time to consider an operation, they need to understand the techniques, the risks associated with those techniques, and the outcomes, and actually the real outcomes. We have many procedures that we do, and we might be able to say, hey, this is a 4 out of 5 chance, but then reiterating the fact that while there is reasonable success, that there's a 1 out of 5 chance that you're not going to be improved. And they have to really know that I take that seriously, that while I still feel that the benefits outweigh the risks, that I take my outcome seriously, and I want them to understand the seriousness of trying to treat neural disease. I let them know that each patient that I treat, I would treat just as I would want to be treated, or I would want to treat my family member. And I wouldn't recommend something just because it's a new technique I just learned. There are often times that I might feel, in certain cases, either another expert's required in a particular difficult case that requires another pair of trained hands, and or that there's something that I'm not expert at enough, and that I would then send them to someone else for a particular condition. I think the most important thing we do is education, and educating them about their problem and what my understanding is of their pathology and what the reasonable remedies are for it. I think that's most important, whether I operate on a particular patient or not.